we're ready to roll.
All right, so I'm here to talk today about Canine Parvovirus, the specifically diagnosis, treatment, and prevention. I'm sure a lot of you are pretty familiar with it from your experiences, but for people who aren't, I'm just going to kind of walk through this. So parvovirus is a very small virus with a capsid or a protein layer around its genetic material. It actually lacks a viral envelope, which is a lipid layer around that capsid, and that actually makes it harder to disinfect. It is actually pretty resilient to changes in moisture and changes in temperature. It resides in the gastrointestinal tract of dogs. It mostly affects puppies under the age of 4 months, but it can also affect any unvaccinated dog. So symptoms of parvovirus are typically lethargy, loss of appetite, hypothermia or low body temperature, dehydration, and then the telltale signs are usually vomiting and diarrhea. The diarrhea often having blood present in it. If not treated, death can ensue in 48 to 72 hours. So how is it transmitted? It's usually transmitted through contaminated feces or direct contact with infected dogs. It attaches to fomites or materials that can carry an infectious agent like collars, food bowls, or fur, or even us.
Yeah, bottoms of our shoes, we track around.
And then it persists in the environment for a long time. I didn't know this, but it can actually persist in the environment for up to a year.
Wow.
So my experiences, I worked over the summer at NOAA's Westside Animal Hospital in veterinary specialty emergency care. As a veterinary assistant there, I usually helped out with hospitalized patients, taking appointments, and treating isolated patients. So this is the first time I encountered parvovirus. Since it's a pretty bad infection, and we don't want to spread it to our other patients, we use Rescue, which is a pretty strong disinfectant that can actually kill parvovirus. We usually douse towels in this and we'll set it on the floor in front of an appointment room, and then step on that once we leave an appointment room that we know has potential parvovirus in it.
Now it says the active ingredient is hydrogen peroxide.
Yeah, that's what I was actually surprised about that. It's like such a common ingredient.
Yeah, it is. And then it says other ingredients. It's like 4.25% hydrogen peroxide and 95.75% other. I wish they would say like water or
And then oftentimes, if we know a case is parvovirus in an appointment room, we might go in with an isolation gown and poly boots. This is a pretty big thing at my hospital because of the layout. We take general practice appointments. It's all one hall. We take general practice appointments on one side of the hall, and then just down the hall we actually take emergency appointments, so there's a lot of shared pathway. We also accept a lot of patients daily that are there for their first puppy visit and are unvaccinated. So it's important for us to not contaminate anything and not transfer that to our new patients or our hospitalized patients. We also, if we know a parvovirus case is coming in, we can also just lead them in through our side door directly into a room.
Yeah, and like when I brought my 2 puppies into the vet a week ago, I took them in a tub. They never touched the floor.
Yeah, sometimes we've had cases where they're out in the car in the parking lot. They don't even come in.
You don't, because it's such a lethal thing, and they came right off the farm. They never had any shots or anything. It's like, okay, guys, you're kind of into isolation in this tub.
Yeah. So once a patient comes into the emergency side of our hospital, a CSR will bring something like this form back to us and then give it to a vet tech or a vet assistant. And at the top, this just kind of has like a patient label on it. It'll have the patient name, the species, the sex, age, and like a patient ID, so we can enter this into our medical records and look up if there's any allergies or if there's a bite risk for this dog. And then it'll often have present concern on it already filled out. So it may be something like vomiting or diarrhea. So I will then get this form and then I'll take it into the room with the client and the patient and kind of discuss, what's been going on with Spot. Has he, been having vomiting and diarrhea for how long? How frequent is it? Consistency. And then we also ask other questions like activity level. Have they maybe eaten something they weren't supposed to? And then are they current on vaccination? That's very important. Since vomiting and diarrhea can be, symptoms of all kinds of things, it's definitely important to differentiate what we're dealing with. And then I'll take this form to my vet, and I will brief them on kind of what's going on with the patient, and then from there we'll kind of decide, does this need a Parvovirus test, or could this be something else? So at our hospital we do a Canine Parvovirus antigen snap test from IDEX. We take this swab right here and swab a fecal sample from the patient, and then this reagent bowl was filled with a reagent that we snap this little purple thing right here that releases the reagent into the swab. We squeeze that 3 times, and then we deposit 5 drops into this fecal sample well. That will then flow across this window into this activation circle, and then we'll snap down the test. It usually takes about 8 minutes to develop the test. It has a positive control up here, and then this is a positive result right here. So if you were to see a circle right here, that is that parvovirus antigen. So this is a rapid enzyme immunoassay for the detection of surface proteins for CPV.
Okay, so I have a question. I understand the positive control. That kind of tells you the kit's working. Is the other blue thing, that's a positive patient then? That only shows up with a patient? This one here, or are we talking about down here?
So, so when we put a fecal sample in here, it will flow across, and then when it hits this activation circle, that's just when we snap the test down. That's not actually like the result or anything. But the results will be seen in this window. There's also a negative control right here, and then this is
that's the patient sample then.
Right. Yes, that is a patient sample. If you didn't see any dots right here, then that would be a negative test.
Gotcha.
So if we decide that this, the Parvo test is positive, we will decide, what kind of course of treatment to go with. If it's negative, it could be all kinds of different things, and we would then maybe go on along with abdominal radiographs or doing some blood tests. But in this case, we're going to say it's positive, so we often recommend hospitalization for patients because most of them that come in are pretty dehydrated, they're pretty sick. So we'll start them on IV fluids and give them Serenia, which is an anti-nausea medication, and metronidazole, which is an antibiotic and anti-diarrheal medicine. They might need other antibiotics for secondary bacterial infections because during this time they're pretty immunocompromised. And then if depending on cost restraints, it is a very expensive thing to treat. We might do an outpatient care using subcutaneous fluids, and then we give a subcutaneous injection of those. Some cases we've had pretty bad patients come in where they're really sick, so we've had to tube feed. We often put them on special diets like Hill's Prescription Science diet, which is a pretty bland food, but it is very high in calories and moisture. Sometimes we need to give the patient a bear hugger, which is a blanket that has warm air going through it, especially if they're hypothermic. And most importantly, we got to keep them isolated. We often recommend to clients that they go home and they bleach surfaces in their house and isolate any other animals in the house that aren't showing signs. So prevention is pretty easy. We offer the DA2PP vaccine at our hospital. This is for distemper, adenovirus, parainfluenza, and parvovirus. And also, one thing I've come across is a lot of times people bring in their animal, it tests parvo positive, and then they go on explaining that they're about to get their animal vaccinated, but what happened is they couldn't call off work, so they missed their appointment. And then 2 weeks later they got parvovirus. So it's very important to get the vaccine. A lot of shelters already have given the dogs the first or second dose of their vaccine. It's just getting those boosters is very important. And then if you know your puppy is unvaccinated and you can't get them, to the vet for a little bit, just keep them away from other dogs. A lot of people like to socialize their puppies when they get them, taking them to like dog parks or something, but that's kind of a place where they can really contract some other stuff too.
Yeah, and if you're ever traveling and you know how you stop in a rest area and it says pet area, you can read that as disease area, parasite area, So I never stop at the rest area. I'll stop at a Walmart or Sam's Club, and you know those big parking lots? Way off in that corner, no one's ever been over there in that grass. But at rest areas, look how many people
Oh, yeah.
stop and have their dogs.
Yes.
So do you know, let's say like you adopt a dog from a family and they say, you know, the dog has all of its shots.
Mm-hmm.
And if you bring it into the vet, is there a way to check to see if they've gotten that shot, or would you just wait to give them another booster?
Right, so if you adopt it from like maybe a family member or a breed or something, they should provide some kind of record of those vaccines. If they can't provide that, then it's safe to say that they should go ahead and probably get another round of their vaccines. It also depends on the age of the dog, how many vaccines they would get or how many boosters. But if they can't provide any evidence of it didn't happen. So it's not going to hurt them to get these additional vaccines. We just want to make sure we give it, a little bit of ample time between that. But certainly, if they're claiming they have given vaccines, hopefully they do have some records. And if they took it into a clinic, it's a quick call to a clinic, so it's easy to obtain those records.
Yeah, because in most cases, somebody wouldn't be able to get the vaccines at a farm store or anything, right?
Right. I know there's
some stuff
there's
sold,
some vaccines,
but
I don't think distemper parvo is one that can be.
There's another question or comment there.
Yeah, I was just going to say a lot of my vet clinics that I've worked at don't take vaccines that are from farm stores, or people that say that they've given rabies vaccines because they legally can't do that.
Yeah, and so
Yeah.
there's a lot of regulation. The other thing about it, and maybe one of the assignments, because I was going to tell you, you got some more assignments because we're not meeting Fridays, but one of them is like maybe about vaccinations and vaccine failures and all that kind of stuff. It's a big bugaboo. Because those farm stores, I'm not going to belittle them, but do you really know if that bottle of vaccine was cared for like it should have been ever since it came from Factory X? Most of them are refrigerated, right?
Yep.
And it's notorious for somebody to have a refrigerator in a farm store and it goes out and then they find out 2 days later and then they just plug it back in or, get it fixed and there was 2 days of room temperature.
Yeah. So another thing I've come across is a lot of owners that get a new puppy, they don't realize that the puppy is going to need multiple boosters depending on its age. This is just our puppy visit protocol for my hospital and maybe different from other hospitals. But depending on the age, how many weeks they are at their first visit depends on how many boosters they're going to be getting. They're going to get distemper parvo right off, and then following with 3 boosters. If they're a little older, they may only receive about 1 booster. But a lot of owners come in and they don't realize the cost of getting those additional boosters. They think sometimes that it's only 1, but it's if you have a child and you go take them to get vaccines, there's oftentimes lots of boosters associated with that.
I'm going to have you finish up in 1 minute.
Okay. And then finally, just informing the pet owners. Something I've come across is we have a lot of information on parvovirus, but there seems to be a gap between our information and what owners know. Giving out parvovirus brochures, the brochures on the distemper parvo vaccine from adoption agencies would be helpful. I know a lot of clinics have partnerships with adoption organizations, so we partner with Uncle Bill's, which kind of prompts people any dog that gets adopted from Uncle Bill's gets a free exam at our hospital. So that kind of prompts them to start wellness care for their dog and then get some more information directly from the vet. Outreach and extension programs are also great. Seminars, I know there's a lot of seminars for CE credits for vet techs and vets, but doing more seminars directed towards pet owners, I would like to see. And then there's now a lot of vaccine requirements for services like grooming, boarding. A lot of them are not just requiring rabies, but also distemper parvo, canine influenza vaccines, and leukemia and stuff. So.
Okay, anybody have a quick question or two? Again, that was